Okay, so now we're finished with cutaneous and subcutaneous. We're heading on to systemic mycosis and opportunistic mycosis. Okay, madali lang naman to. So for systemic mycosis, it affects the organ system. Okay, so because that's possible for the fungi to do it because this fungi, which causes systemic mycosis, has a characteristic of thermal dimorphism. So they are dimorphic fungi, wherein they are in a mold form. So there are filamentous form at 25 degrees Celsius at room temperature, and yeast form when they're inside the body. And most of the time, the mode of transmission of this one are the inhalation of spores. Okay, so direct contact. So diagnosis could be tissue biopsy because it could be inside your body already. So, however, they could be disseminated in your skin, mucocutaneous, mamaya papakita ko. And the habitat of these are in your respiratory mucosa. So, let's have an overview. So, guys, malaman natin na some of the systemic mycosis will be from pigeon droppings. Meron tayong from soil, people who are working in soil. Kung archaeologist ka, depende guys on the areas where you could find this fungi. Or in arid areas or desert areas, yan, marami rin dito sa this part of the US. Yan. Sa mga, ano ba yan? Southwest area. So guys, systemic mycosis are dimorphic fungi. However, some dimorphic fungi could cause opportunistic infection, okay? Pero hindi lahat. So, itong Candida, Cryptococcus neoformans, actually lahat naman sila. If you have a weakened immune system, lahat sila, they could exhibit a systemic mycosis. However, guys, itong mga Blastomyces, dermatitidis, Coccidioides, Histoplasma capsulatum, Paracoccidioides, brasiliensis. Even in healthy individuals, you could be infected with this, okay? So in areas where they are common, endemic sa areas nila yan sa US, okay? But this one, opportunistic fungi, unless you have a weakened immune system, that's the only time that they would show yung mga Aspergillus, okay? So notice, pinapakita dito yung pagiging dimorphic nila. So this is your Blastomyces at dermatitidis at 25 degrees Celsius. Yan, filamento siya. It has blastospores, yung pinag-aralan natin sa una. Blastospores. Anyway, yung asexual spores. And yeast siya at 37 degrees. So yeast itong mga to at 37 at filamento sila at 25 degrees Celsius. And so this is your Candida, Cryptococcus. Your Cryptococcus could also cause systemic mycosis, but I'll discuss it in opportunistic fungi, okay, at Aspergillus. And also Pneumocystis jirovecii, yan, sa opportunistic discussion. So what's the difference between opportunistic fungi and the true pathogens which causes systemic mycosis? So colony morphology. Your opportunistic fungi could be dimorphic, but most of the time they are monomorphic, okay? However, true systemic mycosis are all thermal dimorphic. So they could switch from being yeast and mold. For the habitat, yun yung sasabi ko, they could only be found in the endemic zones. Kung saan nakatira itong mga fungi na to. However, opportunistic, it's Mr. Worldwide. Yan, it's everywhere. Basta magkaroon ka ng weak immune system. Occurrence in humans. So depending on geography, also is linked to infection or diseases. Okay, I'm not sure with that. And opportunistic fungi, it's from your normal flora. They're found in your body, okay, pero out of control lang because of the breakdown of normal flora, of your bacteria, sample prolonged use of antibiotic, corticosteroids. Primary infection, any body site, ang mga opportunistic fungi. However, systemic mycosis, talaga yung sinabi ko kanina, mode of transmission, inhalation of spores. So talaga ang diretso sila sa respiratory system. Virulence is low. Okay? It's low sa healthy human beings. Okay? And true pathogens could infect normal hosts. Growth rate in culture opportunistic fungi is rapid. Systemic fungi that cause systemic mycosis are mabagal tumubo. Okay. So guys, your systemic mycosis, ang pinakaunang ipapakita niya lahat ng mga systemic mycosis is a primary respiratory infection. Okay? So kala mo may flu ka lang pero you have inhaled some spores of this fungi. It could resemble as pneumonia. However, there is formation of granuloma. May mga when we say oma, it's like swelling or tumors inside your lungs. It resembles TB, yung mga systemic mycosis natin. And it could result to acute respiratory distress to chronic respiratory distress. Okay, inflammation causes fluid to leak in the lungs and it could disseminate. So that's why it becomes systemic. It affects other body systems like your skin, yan yung mucocutaneous, bones, reticuloendothelial system. This is part of your lymphatic system, your immunity, and your central nervous system. Kaya you could find them in your CSF. So, simulan natin itong Blastomyces. Dermatitidis causes Blastomycosis. Yan. So, guys, notice, yan. So, na-inhale mo, pero pwede magpakita sa skin, showing cutaneous Blastomycosis. The other names of this one are Gilchrist disease, or Gilchrist Blastomycosis, Chicago disease, and North American. So, dito siya endemic, okay? So, it could cause chronic granulomatous and suppurative disease in skin and mucous membranes, lungs, bones up to the gut. Yan. Wala akong image yung pag mga nasa lungs, bones, and gut na eh. But it also could be seen as a cutaneous blastomycosis. Yan. Elevated, macerated, ill-defined. So wala siyang hangganan, scaly borders, and central ulcers. So it could disseminate in your bones, in your CNS. Next, guys, or Gilchrist. So Blastomycosis, Gilchrist, Chicago, North American, right? Next naman, ito, Coccidioidomycosis. Coccidioides immitis. Coccidioidomycosis. So, class, di ba, yung arthrospores, yung kumbaga box. So, it is disseminated by the fragmentation of the hyphae. Yan, na-inhale. So, guys, usually, sabi niyo, sa nahanap daw, valley fever in California, in the deserts of California, in San Joaquin Valley area. Other names are Posadas disease or erythema multiforme. Erythema, so there is redness. Or it also called as desert rheumatism. So when you were in the desert, tapos biglang you have joint pain, yan. Kasi yun rin yung may joint pain or arthralgia. Kaya desert rheumatism. So it could also be seen in the skin. Yan. Allergic reactions on the skin. Reservoir, so when in San Joaquin Valley, in California, so yung mga desert nila, if there is dust storms, Desert rodents could also carry their Coccidioides immitis, Coccidioidomycosis. Yan. So if you are archaeologists, changes in the condition, yan. Earthquake daw, yan, you could inhale the spores of Coccidioides immitis. Yan. Next guys, histoplasmosis. So interesting to kasi it's found in the cave. Who dwells in the cave? Usually bats. Tapos yung mga droppings ng bats, but also birds. So ang tawag dito, spelunker's disease. So yung mga mahilig mag-spelunking, yun yung usually nagkakaroon ng histoplasma capsulatum. So bat droppings and bird droppings. Yan. So, itong mga droppings na to, yung mga tae nila, class, it has spores. Tapos, you could inhale the spores. How could you also inhale them? In cases of demolition and cleanup projects, especially if bats were living in that area. Sa probinsya namin, may mga bats na nakatira. So, spelunker's disease, so yung mga nagtutour ng mga cave. It's also called as Darling's disease because it was discovered by Samuel Taylor Darling, or caver's disease because yan, being from cave. And this is the most common systemic mycosis in the US. Yan, so you have inhaled itong mga histoplasma capsulatum. So notice, ayan o, may hyphae rin siya. Tapos inhale, tapos it will go to the lungs, the lymph nodes, and the blood. Half of the US could be infected by histoplasma capsulatum. Yan. In cases of warmer temperatures. Yan. So, class, it could also show in our oral area. Yan. So, ito, it invaded the cytoplasm of histiocyte-like cells and have enveloped by a capsule. So your capsulatum has capsule. So ayun, it was ingested by your white blood cells. Yan. So it could also show ulcers in the oral mucosa. So yung sa coccidioides, may joint pains. Ito naman, it could show in your mouth. Sigil cries, yung cutaneous. Yan, blastomycosis sa ilong. Ito rin, si Paracoccidioidomycosis. So this is caused by Paracoccidioides brasiliensis. So it also could be seen in your mucocutaneous area. So South America naman to, common, blastomycosis, or also called as last splendor Almeida's disease. So please take note of the names, okay? So, ito mga granuloma na naman, affecting the mucous membranes and the lungs. It resembles TB. Yan. So, ito naman, itong subcutaneous paracoccidioidomycosis, it has serpiginous lesions. So, kumakalat, snake-like, with active borders and crusted surface. Yung kanina, yung blastomycosis, guys, parang it's ill-defined, wala. Pero ito, it has snake-like yung characteristic nitong lesions na to. So paracoccidioidomycosis, guys, if you will focus it under the microscope, it will look like a mariner's wheel. Yan. Or pilot's wheel. Yan. So Paracoccidioides brasiliensis. So brasiliensis, ang pangalan niya. So it's common in South America, in Brazil, in Colombia. So it's found in the air. Fungus in natural environment, moist oil. Mukha bang mariner's wheel? Ay, mukha naman. So it could affect your mucocutaneous, visceral liver, your organs. Visceral means internal organs, and lymphatic lymph nodes. So, mariner's wheel, yung Paracoccidioides brasiliensis. Next, guys, Cryptococcus neoformans. So, it could it could be both systemic and opportunistic, also called as turulosis, or European blastomycosis. So, It's in Europe. So merong Chicago, San Joaquin Valley, North America, South America. Yun. Most common in the US. So pakialala yung mga yun ha. So, it's from pigeon droppings naman. So the fungi is in the pigeon droppings or pigeon's excrement. It could cause fungal meningitis. So guys, ang mga meningitis, it's mostly common. Usual cause in a healthy individual are bacteria. Pero if you have weak immune system, fungal siya. Just like pneumonia, usually bacteria naman ang pneumonia, pero pag humina yung immune system mo, fungal. So your Cryptococcus, guys, could be stained by your India ink. Pag in-stain mo ng India ink, it would look like it has a capsule. So, kumbaga parang may halo. So, mapapansin mo ang ganda dito ng yeast cell, di ba? So, ito yung protuberance. Yan. So, yung CSF, pag nakita ng ganyan, na may Cryptococcus neoformans yung pasyente. So, we're heading now to your opportunistic mycosis. Yan. So, we have three, but we will discuss. We have the Candida, the Aspergillosis, and the Pneumocystis, carinii, or Geravettii, double I to. So, mas updated yung pangalan na Geravettii. So, double I, please ha. So, let's start with Candidiasis. So, we have other Candida, which is your Glabrata, Paracoccidioidomycosis, Tropicalis, and Cruzi. So, the clinical significant one is albicans. So, it's also important na ma-identify natin na albicans talaga siya, okay? So, virulence factor are your adheses, ligands, proteinases. It breaks down protein, phospholipases. So, this breaks down your cell membrane, germination, phenotypic switching, hydrophobicity, and molecular mimicry. So, it could copy other antigens into the body. Yan. So, ngayon, so this is an opportunistic infection. So, this usually happens among immunosuppressed patients, prolonged use of corticosteroids or steroids, chemotherapy, catheter use, prolonged use of antibiotic. If you have hematologic malignant diseases just like leukemia, burns, drug use, pregnancy, carriage, oral dentures, high carbohydrate diet, increased CD8 cells, and if you are third trimester in the pregnancy. So CD8 cells are these are T cells. Yan, baka magkamali ako. I think it's T cytotoxic cells. So guys, how do we diagnose candidiasis? So we use KOH. Yan, we could see the yeast or the spores. For the culture, we could have the monomorphic. It has one form in our colonies. So mukha siyang bacterial colonies. Yan, yellow yeast colonies or white. So you could grow it in sabrodextrose agar, cornmeal agar, and chlamydospore agar. It could be, you could identify that it's Candida albicans through germ tube and its use of carbohydrate or carbohydrate assimilation. Pero ang didiscuss ko lang germ tube, guys. And the treatment are here. So topical, we have nystatin, cotrimazole, ticonazole, oral, fluconazole, ketoconazole. If deep, kailangan oral or IV antifungal. Naku, mahal rin. Mga antifungal na IV. So guys, this is after an oral scraping. This is your yeast in oral scraping. So, ayan yung mga makikita mo yung mga buds. Ito guys. So, to identify if the Candida is really albicans, you could perform germ tube test. Yan. So that you could differentiate Candida albicans to other Candida. So, ang isa sa 95 to 97% of Candida albicans, guys, will develop a germ tube. So, ito yung itsura ng germ tube. Yan. May isa pa ba akong photo? Yan, germ tube yan. Yan, no constriction daw. Or no septate. So, ang Candida albicans nag-grow ng germ tube if it's exposed to a serum, human or sheep serum for 3 hours. So, after 3 hours mo pa makikita. So, if the yeast form a germ tube, yan, it's 95% positive ka na Candida albicans. Yun, okay. So, after exposing it to serum, you could now focus it under the microscope, add KOH, tapos, yun, you could see the germ tube. So, you have 95 to 97% chance na it's Candida albicans. So, this is how your Candida albicans look like at Saborodextrose agar. So, i-google nyo lang SDA agar for Candida albicans to know the spelling of Saborodextrose agar. And so, yeast siya. Parang bacterial colony. So, ang matindi guys sa candidiasis, it could be disseminated or deep candidiasis. It could reach your gastrointestinal tract. Tindi, no? May superficial. And so, review natin lahat. So, we have cutaneous candidiasis. So, it's in the skin. So, parang rash siya. In the intertriginous area. Could you search what is intertriginous area? We also have Candida paronychia, wet workers, disease. Yan. So, especially nga if your hands is always exposed to water, like if you are a laundry worker, yan. Basta lagi nababasa yung mga kamay at paa. We have oropharyngeal candidiasis or oral thrush, vulvovaginal candidiasis, or just yeast infection. Yan, merong white curd-like discharge, or strawberry lesion, or dyspareunia. So, may mga diabetes mellitus, STD, third trimester of pregnancy. Bakit kaya? High risk ang mga third trimester pregnancy. And post-pubertal, yan, after puberty. We also have ocular candidiasis sa mata. Yan. So, corneal erythema or ulceration, prolonged use of corticosteroids. Yan. So, this is your rash. Tawag dito. Cutaneous candidiasis. Diba? Kawawa naman yung baby nito. We have wet workers' hands. Yan. And ito, inopen na yung vagina. So, we have vaginal yeast infection. Yung may mga discharges na white. Yan. So, pag maraming masyadong discharge, guys, yan, it could be infection and it's itchy. Oral thrush, kawaman tong baby. Ocular candidiasis, so, andito sa may eyelids natin. Opportunistic mycosis, so deep candidiasis, so it could affect your esophagus, your gastrointestinal tract, yan, the peritoneal area, yan, especially in dialysis patients. Okay, respiratory tract and urinary tract. So it could also result to septicemia. It could enter your bloodstream, heroin abuse, prolonged use of catheter and prosthetic heart and joint valves, endophthalmitis, retinal lesions, osteomyelitis also, and the CNS. Finally, malapit na dalawa nilang. We have Aspergillosis, guys. So, inhalation na rin to. So, specimen sources are scrapings from tissue, pulmonary fluids, and diagnosis. We perform KOH, culture, and biopsy. Treatment is amphotericin B and itraconazole. So, we have Aspergillus fumigatus, flavus, niger, and pterygius. And so this one is niger, Aspergillus niger, niger. Aspergillus fumigatus. Yung mga conidiospores. Walang sac. Ito rin walang sac. So, forms of Aspergillosis, sabi niya sa x-ray daw, may crescent sign. It's also called as aspergilloma. So, inhaled conidia entrapped, na-trap daw in cavitation. So, it looks like the patient has TB or chronic obstructive pulmonary disease. Pero aspergillosis pala. So, nagsimula na parang asthma lang, tapos aspergilloma, tapos invasive na. So, it could enter your brain, causing meningitis, eye, causing blindness, sinus, causing sinusitis, heart, causing inflammation of the muscle, heart of the muscle, ears, automycosis. And finally, guys, ito yung Mycoses durevetsii pneumonia. Yan. Common to sa US among AIDS patient na. So, ito yung normal lang. Ito yung infection of pneumocystis carinii or durevetsii. Layo, no? That's the end of mycology, guys. Thank you for joining me. I'll see you again. Bye!